As a physical therapist, I've seen countless knee replacements and have helped many people regain full mobility and strength, but your road to recovery won't look exactly like everyone else's. Let's talk about what to expect after your knee replacement surgery and 3 things that you really need to consider. Now, the very first week after you're discharged from the hospital, you'll probably use a walker to get around the house, and then you're going to be heading to physical therapy, where your physical therapist will help you progress from using that walker to a straight cane to hopefully nothing at all. And they'll probably start with this very first exercise, which is key to your recovery, and that is to perform ankle pumps. Tip number 1 is to get used to doing ankle pumps. This is one of the very first exercises you'll learn after your knee replacement, and it's really important. The reason we prescribe ankle pumps after a surgery is to promote blood flow and to prevent blood clots. Blood clots can happen for a number of reasons, and for someone who's recovering from a knee replacement surgery, one of the most common reasons or causes of a blood clot is just lack of movement. Pumping your ankles up and down or tapping your toes in the air will engage the calf muscle, which works as a sort of sump pump to the body, causing blood to flow back up towards the heart and back into circulation. Ankle pumps can be a great exercise to perform throughout the day, and especially at night when your legs feel tired and swollen. To do so, simply elevate your legs, apply ice to your knees, and perform 20 to 30 ankle pumps at a time. This routine should help to relieve some of the pain around your knees, reduce swelling, and improve your overall recovery. Here's another pro tip: avoid sitting for long periods of time. Get up and move around every 20 to 30 minutes throughout the day. That will really help to circulate some of that fluid throughout the body. Tip number 2 is this: don't overdo it. I know I just said it's important to get up and to move around, especially if you've been sitting for a long time, but the reverse is also true. You shouldn't really overdo it. You want to move enough to help your knee, but not so much to hurt it. One of the most common mistakes I see among people following a knee replacement is trying to overdo activities. Too much, too soon. And many people try to go to the grocery store right after a knee replacement only to experience some tremendous pain, discomfort, and increased swelling that evening or even the next day. If you overdo activities and you just try to walk it out, you could really slow down your recovery, so stick to your physical therapist plan or your doctor's instructions regarding post-op activities and ask them how far you should be walking each day. Your physical therapist will also show you how to use your walker or your cane with proper gait patterns and not a limp, because we do not want to retrain a limp as you recover. So remember to progress your activities gradually and to stick with the plan, because you don't want to overdo it and not have any energy the next day to do your physical therapy exercises. Tip number 3 is to continue your exercises after physical therapy. When you're all done with physical therapy treatments, it's really important to continue to do your exercises on your own. Even if you feel back to normal or you have little discomfort, that doesn't mean that your knee is fully recovered. The healing process after a total knee replacement continues for upwards of a year, and in the weeks following your discharge from physical therapy, make it your goal to continue building more muscle and restoring your knee to full mobility and strength. You can find some great lower extremity exercises on this channel and in upcoming videos, so be sure to subscribe to the channel so you don't miss those. Let me know what questions you have, and be sure to give this video a like if you found it to be helpful as well. Thanks for watching, and I'll see you in the next video.